And as millions are awaiting their COVID vaccines, a warning tonight. It's not about the vaccine itself, but the fact that who gives you the shot could also make a difference. Investigative reporter David Goldstein has this story.
Hundreds of medical volunteers are being enlisted all around the area to give COVID vaccinations, even students. One LA man says a pharmacy student made a mistake and now he's paying the price.
I couldn't move my arm. I could only move it about 10 degrees before lifting my arm before. It was just excruciating pain, like a knife going through my shoulder.
Sung Cho is a healthcare worker lucky enough to get his COVID vaccine.
Everyone wants it, and there's just so much demand.
But in the days after getting his shot at this LA City-run site in Lincoln Park, he says he couldn't function normally.
I can't lift my kids up anymore. I can't play basketball. I can't play with them anymore. I thought my life was over.
Cho was diagnosed with what's called SIRVA, shoulder injury related to vaccine administration. It's when the vaccine is mistakenly injected into the bursa space below the deltoid muscle in your arm instead of the muscle itself. Doctors say the pain can last anywhere from days to weeks to months.
So I can't go higher than that right there.
In Cho's case, he says the COVID vaccine was given by a pharmacy student who he claims made a mistake.
I think she's innocent to it. I just think that she did not get the proper training. I find that very infuriating.
The city of LA says every one of the over 190,000 vaccines given at our sites has been administered by trained and certified clinicians that include professional staff and students. The mayor and our public health professionals have full confidence in the work they're doing. USC says their pharmacy students are supervised by USC pharmacy faculty, licensed by the state as intern pharmacists, and have vaccinated nearly 27,000 people at the COVID site in Lincoln Park. While SIRVA is considered rare, Congress did set up the National Vaccine Injury Compensation Program in the 1980s so victims can get money for mistakes. But days before former President Trump left office, Alex Azar, the then Secretary of Health and Human Services, set in motion a plan to eliminate shoulder injuries from the program.
I mean, these are real injuries that really impact people's lives.
Attorney Leah Durant, who herself is a SIRVA survivor, says it'll cut benefits for 65% of the victims in the program and many more who may be harmed after getting their COVID vaccines.
This was something like we've never seen in the vaccine program, really talking about a change that's been made in the 11th hour that will impact just many hundreds of thousands of Americans.
So how can you protect yourself?
Make sure that they inject the vaccine into the deltoid muscle. LA
dermatologist Dr. Jessica Wu says, watch where the shot is going.
Be aware that it shouldn't be right up here by the bone. So it should be somewhere down here, and ask the technician or the nurse or the physician, could you just take a minute and show me exactly where you're going?
Cho says he'll use the advice for his second COVID vaccine, and despite what happened to him, he strongly encourages everyone to be vaccinated.
Everyone needs to get it. I'm a huge, not anti-vaxxer, but everyone needs to get it, but they need to be done properly.
The federal government right now is reviewing the changes to the vaccine program to possibly continue to cover shoulder injuries. But the takeaway for this story is get your COVID vaccine when you can, but be aware of where it's going. I'm David Goldstein, CBS 2 News.